Fatty liver disease is silently spreading across the world right now, affecting hundreds of millions of people. And the most terrifying part is that most of them have absolutely no idea it's happening inside their bodies, because unlike heart attacks or strokes, fatty liver disease rarely screams for attention. It whispers, quietly, patiently, until the damage is advanced and sometimes irreversible. And that is exactly why doctors now call it one of the most underestimated killers of the modern age, because what starts as a little extra fat in the liver can quietly progress into inflammation, scarring, liver failure, and even liver cancer without obvious warning signs. Your liver is one of the most hard-working organs in your body, responsible for detoxifying harmful substances, regulating blood sugar, processing fats, and producing vital proteins. But when excess fat builds up inside liver cells, often due to poor diet, insulin resistance, obesity, high blood sugar, or metabolic syndrome, it disrupts these functions at a cellular level. And over time, this fat accumulation triggers inflammation known as non-alcoholic fatty liver disease, or NAFLD, which has now become more common than alcohol-related liver disease, even in people who never drink alcohol. And that alone should make you pause, because this is not a rare condition affecting only unhealthy individuals. It is increasingly found in normal weight people, office workers, young adults, and even children, largely driven by ultra-processed foods, sugary drinks, refined carbohydrates, sedentary lifestyles, chronic stress, and sleep deprivation. In the early stages, fatty liver disease causes no pain because the liver has no pain receptors, so damage can progress silently for years. And many patients only discover it accidentally during routine blood tests or an ultrasound done for another reason, often after liver enzymes like ALT and AST appear mildly elevated. But here's the danger. Normal blood tests do not always mean a healthy liver, and many people with advanced fatty liver disease have completely normal lab results, which is why this condition is so deceptive. As the disease progresses, fat accumulation leads to inflammation called NASH, or non-alcoholic steatohepatitis, and this is where the real danger begins, because chronic inflammation causes fibrosis, meaning scar tissue starts replacing healthy liver cells, slowly reducing the liver's ability to function. And unlike fat, scar tissue does not simply disappear, it permanently alters liver architecture, restricting blood flow and impairing detoxification. And if this scarring becomes extensive, it leads to cirrhosis, a life-threatening condition associated with internal bleeding, fluid accumulation, confusion due to toxin buildup in the brain, and a dramatically increased risk of liver cancer. What makes fatty liver disease particularly dangerous is its close relationship with other chronic illnesses. Because it is not just a liver problem, it is a systemic metabolic disease, strongly linked to type 2 diabetes, high blood pressure, abnormal cholesterol, heart disease, and stroke. And studies consistently show that people with fatty LI, liver disease, are more likely to die from cardiovascular disease than from liver failure itself, meaning your liver fat may actually be signaling a much deeper metabolic breakdown happening throughout your body. Symptoms, when they finally appear, are often vague and easily dismissed. Persistent fatigue, brain fog, right-sided abdominal discomfort, bloating, unexplained weight gain, difficulty losing weight, darkening of skin folds known as acanthosis nigricans, and worsening blood sugar control. But by the time these signs become noticeable, significant damage may already be present, which is why early awareness is critical. Diagnosis usually begins with imaging such as ultrasound, fibroscan, or MRI, but the gold standard remains liver biopsy in uncertain cases. Although non-invasive tools are improving rapidly, allowing doctors to estimate liver stiffness and fat content with increasing accuracy. Yet despite its growing prevalence, there is still no single FDA-approved medication that can cure fatty liver disease. And that may sound alarming, but it also reveals something powerful, that lifestyle changes remain the most effective treatment available, and in many cases, the disease is reversible in its early stages. Weight loss of just 7 to 10% of body weight has been shown to significantly reduce liver fat and inflammation, while improving insulin sensitivity. And this does not require extreme dieting, but rather consistent, sustainable changes, such as reducing sugar intake, eliminating sugary beverages, limiting refined carbohydrates, prioritizing whole foods, increasing NG protein and fiber, and choosing healthy fats like olive oil, nuts, and fatty fish. Physical activity plays an equally vital role because exercise reduces liver fat even without major weight loss, and both aerobic activity and resistance training improve liver metabolism by enhancing insulin sensitivity and reducing inflammation. Sleep quality, stress management, and gut health are increasingly recognized as critical factors as well, because chronic stress hormones promote fat storage in the liver, while poor sleep disrupts glucose regulation and appetite control, further worsening metabolic dysfunction. Alcohol, even in moderate amounts, can accelerate liver damage in people with fatty liver disease, which is why doctors now recommend minimizing or completely avoiding alcohol once the condition is diagnosed. And medications must be carefully reviewed because some drugs can worsen liver stress. The global rise of fatty liver disease reflects a deeper societal problem: modern diets engineered for pleasure rather than nutrition, environments that discourage movement, and healthcare systems focused on treating symptoms rather than preventing disease. But the hopeful truth is that your liver has an incredible capacity to heal if given the right conditions, and thousands of studies now confirm that lifestyle-based interventions can halt and even reverse disease progression when implemented early and consistently. Fatty liver disease is not a death sentence, but ignoring it can be. And the most dangerous belief you can have is "I feel fine, so nothing is wrong." Because this silent killer thrives on neglect, not pain, and awareness is your strongest defense. If this video helped you understand what fatty liver disease really is and why it matters far beyond the liver itself, make sure to subscribe to the MedLogic channel for evidence-based medical insights that can protect your health and potentially save your life, because knowledge is not just power, it is prevention.